Please welcome Stephen Gordon.
Thank you. Thank you, thank you, thank you. Right. Well, thank you all of those who've stayed behind for the last presentation. Your stamina is amazing. And may I wish Godspeed and safe journeys to all those who have already gone. I feel slight fraud standing up here because I was not a member of the consortium that carried out this project. I was, however, a member of the advisory board of that project, and because Birgitte couldn't persuade anyone to come from the actual consortium to do this presentation, I'm doing it for you. And therefore I'm very grateful to Wolfgang Weidenhammer, who was the project coordinator based in Munich, who actually gave me his presentation lock, stock and barrel, so I didn't have to write it. So I'm just going to give it based on my understanding and experience of the project, which I've lived through for the last 3 years. But as I say, I'm very grateful to Wolfgang, who I met 2 or 3 weekends ago in Portugal at a conference, and I just said, Wolfgang, can I have your presentation? Because this is the one he gave at Portugal, and he very kindly gave it to me. So this is Wolfgang Weidenhammer, aka Stephen Gordon. Okay. So this was a project set up to gather evidence about the situation for complementary medicine across Europe, on the basis of which they were then to create a roadmap for European CAM research. So that was the target, was to create this roadmap for future research, but to do that they had to collect evidence on all aspects of complementary medicine across Europe. And they call themselves CAMbrella, using the idea of an umbrella in complementary and alternative medicine. So here is a brief summary. The aim was to review the status quo of complementary alternative medicine from different perspectives in the EU and to provide a proposal for CAM research. The impact was a research roadmap and network to enable sustainable and prioritized CAM research in the EU. The consortium was made up of 16 participants from 12 European countries, plus 1 adjunct partner from the Netherlands, and there was an advisory board of 12 international European CAM organizations, of which ECCH was one of those members. And by default, so therefore was SAC, if you like, because SAC is our ECCH member in Sweden. And they got funding of 1.5 million euros from DG Research under the FP7 program. Now, 1.5 million euros sounds a lot. To homeopaths, it's a lot. But it's peanuts in terms of DG Research's budget. And the coordinator was the Klinikum Recht de Isar in Technikum University Munich, and that was where Wolfgang Weidenhammer pulled all the strings and got everybody to do what they were supposed to do. And the project ran from January the 1st, 2010 to December of last year. Right, so it was FP7 funded, a research-oriented project, not a collaborative project, but a coordination action. It simply means that all these centres coordinated all their data collection, etc., etc. But it wasn't a kind of hard research project in the way that we know it. So this is the work programme. This is DG Research put out what they call a call for tenders. And this was the wording of the call, and a number of people bid to get this job. And funnily enough, ECCH was a partner in another group that bid to get the work. But they failed, and the CAMbrella people won, and we were engaged with this project as an advisory member. So in order to create the knowledge base concerning the demands for complementary alternative medicine in Europe and the prevalence of its use in Europe, consensus on the terminology of complementary medicine and the definition of respective CAM methods needs to be established. The current state with respect to the provider's perspective, as well as needs and demands of the citizens, should be explored, and the different legal status of complementary alternative medicine in EU member states needs to be taken into account. And a roadmap for future European research in this area should be developed. So that was the job description that they put out into the world for people to bid for, to do. Plus with the, the money, the knowledge that there's up to 1.5 million euro available to do the job. So when CAMbrella successfully bid for this. They got the job. And so they analysed the paragraph, and they split the paragraph up, and as a result, they formed 7 work packages to take on all the different aspects of the work as described in the paragraph. So you can say work package 1, 2, 3, 4, 5, 6, 7, and there was an 8th work package as well, which I'll explain later. So this is how they divided it up. Work package 2 was purely to look at the legal status and the regulation of complementary medicine across Europe. Work package 3, the needs and attitudes of citizens. Work package 1, terminology and definitions. Work package 6, that was the research where they looked at the global perspective, comparing the situation in Europe with what was going on in the rest of the world. Work package 4, CAM use, the patient's perspective. Work package 5, the provider's perspective. And work package 7, they were the ones who had to review the CAM research methodology and create the roadmap for future research. And then work package 8, their job was dissemination and communication, sharing the information with everybody afterwards, creating the documentation, the website, and all that sort of thing. So all these kind of had interconnections. So the arrows show you how there was cross-fertilization going on between all the different things. But in essence, everything was focused on work package 7. All the information that was gathered in these other work packages was focused on informing the creation of this research roadmap for the future. So if we quickly go through the work packages one by one, the terminology and definitions of CAM methods. This is led by Bernhard Ulecker at the University of Zurich. And the CAM utilised by European citizens represents a variety of different medical systems and therapies based on the knowledge, skills and practices derived from theories, philosophies and experiences used to maintain and improve health, as well as to prevent, diagnose, relieve or treat physical and mental illnesses. CAM has been mainly used outside conventional healthcare, but in some countries certain treatments are being adopted or adapted by conventional healthcare. Now, if you look at the name under, there's a name, Torkel Falkenberg et al. And that definition we slaved over at a little place in Sweden called Jana. You know Jana, those of you? Well, just south of Stockholm, we had what we call a consensus meeting where they called the advisory board together with the consortium members, and we went down to Jana, and we had to work out this definition. They could not agree a definition of complementary medicine, and this is what we've come up with, is the overall definition. And I'm pleased to say that there's some bits in there that I contributed to, but I won't. Mainly because I was one of the few native English speakers, and the whole thing was done in English. And being one of the few English speakers involved on the advisory board, one had a slight advantage, so one could, make wise suggestions occasionally. So that was the overall thing we came up with. But the work package 1 was also, we went through all the terminology and definitions, and you know what a bunch of nitpickers CAM therapists are. We had all these different, the advisory board exchanges between the work package and the advisory board members of, oh, no, you can't say this, no, it doesn't mean that, no, shiatsu is this or this. It was a very difficult job to build up a list of definitions that everyone could agree with, and of course not everybody has agreed with the final list. But anyway, nonetheless, there is now a document which has all the terminology and definitions in it as a reference. And of course, you better remember, these documents are now gone into the European Commission, and they're now established reference documents for the future people working in the area of CAM. So they're important documents. Work Package 2, the legal status and the regulation of CAM in Europe. And the leader here was Vinja Funnebo from NAFCAM in the north of Norway, University of Tromsø in Norway, and he had a wonderful woman working with him called Solveig Weisner, who basically did all the work. Funnebo just kind of like directed things, but she did all the work, and she was traveling all over Europe, visiting government departments and getting information, and in this drawing up this picture. And what's written here, the EU has repeatedly confirmed it's up to each member state to organise and regulate their healthcare systems. But medicinal products, of course, are not defined as part of health policy. They're part of the internal market, and therefore they are regulated. So, but their summarizing statement was about the legal status in Europe is the only common factor we found across all 39 nations is the amazing ability they have demonstrated of structuring legislation and regulation differently in every single country, no matter how small the size of the population. And so this is the situation. It's completely heterogeneous. Every country has a different situation to the next one. And you've got situations like, this stupid thing you've got here in Sweden. You're completely unique. You can't treat children, you can't treat pregnant women, doctors can't practice homeopathy. You are unique. But nonetheless, there are other countries which have got other silly laws. Right. Work Package 3, needs and attitudes regarding CAM among EU citizens. This was to identify stakeholders and indicators for needs for CAM and to establish an overview of needs and attitudes towards CAM in Europe among citizens. Citizens' core attitudes and needs. So, some summarizing statements. CAM is seen to consider the whole person and to be safer than biomedicine. The availability of impartial, reliable and trustworthy information about CAM is needed, and wider access to and choice of CAM provision and providers within public health care is needed, and they want clear regulatory and educational frameworks for CAM. So, University of UCLan, well done. So, then we had the patient's perspective, which is slightly different to the needs and attitudes among citizens. You have the patient's perspective. And the overall, this was led by George Lewis of the University of Southampton. And their conclusions were there's poor data quality, the data on use is very poor. Less than half of EU member states have any data on the use of complementary medicine. Only 5 or 6 states, Germany, the UK, I think France, and a couple of others, really have any decent data at all on use. What is CAM? There's complete confusion. Some therapies are widely used, like homeopathy and acupuncture, for example, and then you've got much smaller things like shiatsu, and then we go into the realms of things like... They actually came up with a list of 14 therapies which they agreed they were going to include in their researches, and all others were just ignored. So, so things like, I don't know, Reiki or... acupressure, those kind of things just didn't come into their, because they just couldn't do it all. They couldn't cover all the therapies. And there's a need for coherent, comprehensive, and rigorous prospective data collection. ICAM-Q has low face validity, low acceptability, and is likely to produce biased estimates of CAM use if used in England. I think this was some sort of questionnaire that they established. I'm sorry, I can't tell you more about ICAM-Q, but it was a questionnaire they set up, but it didn't work very well, basically. Further work is required to develop the layout, response options, and instructions on completion. So then we had the provider's perspective, and this was another hotbed of dissension with the advisory board members. The advisory board members were mostly medical doctors practicing CAM, so we had the European Committee for Homeopathy, which is the parallel body to ECCH, representing the practitioners of homeopathy. Then we had ICMAT for the medical acupuncturists. We had the anthroposophical doctors were there, and there were other groups representing practitioners. And the provider's perspective, CAM provision in Europe comprises healthcare practitioners and physicians with different healing attitudes, medical background, training, certification, and practice. And data are only available if they're registered in any specific body open to the public and therefore very scarce. Scientific publications are almost rare. So it was very difficult to collect data because in many countries, like the UK, for example, no one has to join a register. I mean, someone can set up... This was Vinjar Fernabo when he was talking about the situation legally. His favourite story was that in Norway, a bricklayer can decide to put a sign up at his door tomorrow and say he's a homeopath and start treating people. This is Vignard's famous favourite story. A bricklayer can tell you he's a homeopath tomorrow and start treating you without any training. There's no legislation. There's nothing. The only thing he can't do in Norway now is to call himself a registered homeopath. But nonetheless, and it's the same in England. I mean, in England, anyone, any Tom, Dick, or Harry can set himself up as an acupuncturist or a homeopath or whatever in the UK now tomorrow without having any training. Osteopaths and chiropractors now are statutorily regulated, and no one can call themselves an osteopath or a chiropractor in the UK unless they're on the statutory register. So they've got protection of title, which is what, if you remember yesterday, I talked about the Portuguese situation and the situation now in Ontario. They will have protection of title. But it doesn't mean protection of function. People still can do homeopathy, they just can't call themselves a homeopath. So anyway, data was very difficult to collect, and so they only contacted official bodies of practitioners. They got information from the governments when they could, but really it was a very difficult situation collecting data. And then they say scientific publications are almost rare. There are very few scientific publications. I mean, things like homeopathy that Peter edits, I mean, they're such a rarity across Europe. So CAM provision in Europe requires transparent harmonization. These are recommendations. CAM provision in Europe requires transparent harmonization of CAM training, continuous medical education and certification. It requires publicly accessible standards of regulation and registration for both therapists and products, and prospective and controlled comparative state-run studies of public demand, outcome and cost effectiveness at a nationwide or EU level. Some of the things we've been talking about earlier on today, things like cost effectiveness, etc. Work Package 6 then looked at the global perspective. And this was, again, Torkel Falkenberg of the Karolinska Institute. I'm sure most of you are familiar with that. And they looked at what was going on in countries outside of Europe, in particular Australia, Asia, and North America. And they noted the scarce European public investment in the field, in contrast to the large investments found in Australia, Asia, and North America. You probably all know that the North American Institutes of Health set up the National CCAM Committee, is it, Peter? Committee? Something. CCAM in the NIH. NCAM, and they have a budget. I think this year it's $155 million to invest. This is what they get every year to invest in researching the aspects of complementary medicine in Europe, in the United States. Sorry, and the Chinese government, for example, are really pushing traditional Chinese medicine, investing vast amounts in it in China itself, but also really pushing it here in Europe. So there's an emerging shift to support a broader research repertoire, including qualitative and comparative effectiveness research. This is what is needed when you've heard that today already. The EU should consider these trends given the experiences and the substantial research funding committed by the included stakeholders. Sorry, but I don't quite understand what that means. But anyway... But anyway, the point being that globally, in some countries have invested a lot in complementary medicine, and the EU, by contrast, and its individual countries have invested very little. I mean, this 1.5 million that the EU has invested in this project is, I think it's only the second time that the EU has invested any money in complementary medicine. Under FP6, I think they had a CAM and cancer project, which was run, I think it was run by NAFCAM, or it's been taken over by NAFCAM. But no, we never knew it. No one heard about the project until it finished. I didn't know about it, and actually, it's a very poor. The results are very poor. I don't know how they got away with it. That's my personal opinion. So then, Work Package 7. Then, as I said, they had the job of getting on the basis of all the information gathered in these other work packages, drawing up this roadmap for European CAM research. And the leader in this was Benno Brinkhaus, who's based at the Charité University Medical Center in Berlin, in Germany. And, I mean, their objectives were to provide a research roadmap for clinical and epidemiological research for CAM. Brackets, not for basic science. The whole project just excluded anything to do with research in basic science, the sort of thing that Peter's been talking to you about earlier on today, and Alex and Lionel. None of that, that's not to be covered. So they're only talking about clinical and epidemiological research. We need to establish a solid evidence base that enables European citizens and medical and non-medical healthcare providers to make informed decisions, and to propose a methodological and strategic research agenda for the field of complementary medicine to address future European healthcare challenges such as chronic disease and healthy aging. And those are key phrases, really, because it has to, you know, if out of CAMbrella they're going to build a relevant research agenda and one which can get funding, and that is the next phase from the European Commission, then it has to be relevant to the challenges that are facing Europe and Europe's population in their health. With Package 7, they did a huge literature review of CAM research methods, and they looked at findings and conclusions from the other six work packages. They had expert workshops run on CAM methods, and they had consensus meetings to agree on their final recommendations. So these are the key areas that they identified. CAM research roadmap key areas: citizens, prevalence, context factors. Come on to that in a minute. Research infrastructure, CAM integration, integrated into healthcare systems, research funding, effectiveness, and safety. And in the center of it, they recommended a mixed methods approach, and you probably can't read the purple bit, but it says it must have stakeholder involvement, which is an interesting recommendation, because so much of research is carried on in a little hothouse by researchers. And what they've discovered, not just in this area of complementary medicine, but it's extremely important to have stakeholders involved in developing research protocols, methodologies, and you know, why you're doing the research, and creating the questions that you ask, because they have to be relevant to the stakeholders, the citizens, the practitioners, and etc. So. So they recommended building on what they'd done in some of their work packages anyway. So for the citizens, a pan-European research program. For prevalence, an EU-wide approach to assessing the prevalence of CAM. So again, building on the very difficult work they'd done previously. This is the interesting one, going back to our discussions earlier on today. Context factors, differentiating specific effects from meaning and context effects. And those of you who know George Lewis will know that he was highly influential in getting that bit in there. This is one of his favourite hobby horses. And then building a research infrastructure, CAM integration, description and evaluation of existing models for CAM integration. So how you integrate CAM into the healthcare systems, for example, which, I mean, there are isolated models, like we have the hospital that Peter runs in London. But, you know, at the moment, they're trying to chase homeopathy and complementary medicine right out of the National Health System, United Kingdom. Peter's hanging on by the skin of his teeth. And then there's looking at research funding, looking at effectiveness, CAM research in real-world settings. Again, this was emphasized earlier on today. Doing comparative effectiveness in real-world settings. That's where we're going to get our message across, is showing, you know, forget all the sort of basic stuff, not just showing that someone who goes to see, people who go and see homeopaths in their clinics compared to people who are just having ordinary treatment. Peter described his protocol for his depression project, similar sort of thing. You're comparing a group that get homeopathic treatment compared to people who are just getting ordinary stuff in the real world. And this is the best kind of evidence we can build. And then safety, European-wide monitoring and a registration system for the safety of the various modalities, and where there are medicines involved, obviously that's already covered to some extent. So, how are we doing? I mean, this is a bit repetitive, really. You've got the prevalence, you've got the needs and attitudes of citizens. We've already really talked about this. For example, finding out the most prominent disorders treated and which kind of CAM treats them, and looking at the inclusion of health economic aspects of CAM. Again, the whole health economic thing is becoming increasingly important. All our countries, their health budgets are continually going up. We're all in these confined economic straits due to the recession, etc., etc. So governments and the EU are desperately looking at how they can contain health costs. Safety, observational studies, clinical trials, single case studies, clarification of terminology, taking CAM as a complex treatment and taking drug interactions into consideration. This, as you're probably aware, this has become a new concern and a new stick to beat us with, where they're beginning to say, oh, homeopathy or herbal medicines, they interfere with conventional drugs. If you take this with that, then it's a great risk to the patient, so they shouldn't take herbs without talking to their doctor, because no discussion about stopping the conventional drug, only stopping the vitamin or the mineral or the herb. But anyway, I guess they have, in putting together these recommendations, they had to include these things in a way. So, comparative effectiveness, pragmatic trials, including health and economic evaluations, meaning and context factors, we've just looked at that, experimental studies to investigate the underlying mechanisms of CAM, clinical trials including qualitative studies, and then this differentiation thing between specific and context effects. To investigate different CAM integration models, this is the competitive model, the integrative model, and the pluralistic model. I think you can understand what each of those means. I think competitive just means two people doing the same thing but not interacting, but just competing with each other. Integrative means people working together. And pluralistic, I think that's, I'm quite sure, I mean, whether that's, any idea what pluralistic would be compared to integrative?
Parallel, I think in parallel, not interactive.
Yeah, okay. Anyway, reliable description and evaluation of existing models of integration and using a mixed model methods approach, including different epidemiologic evaluation methods. Work package 7, building research networks in Europe, attracting experienced researchers to build research capacity, offering fellowships at junior research levels, and developing structures that allow the dissemination of high-quality information about CAM. So this all, and the call for sufficient independent CAM research funding, and the word independent is quite important. Obviously, in the conventional world, a lot of funding comes from the pharmaceutical industry for research. But in our world, we don't have any sources of funding. And this is where I'm going to come on to a minute onto Europe, because we need public funding, really, to help us pay for the research into our area. We don't have any rich industry that's going to pump money in. Okay. So, again, so one of their final conclusions, or their calls, was to call for European CAM research infrastructure. First thing, a European CAM research coordination office to foster systematic communication between EU governments, researchers, and stakeholders. And secondly, and this is, dare I use the phrase, highly hopeful, an EU-funded European Centre for CAM to stimulate and support high-quality research on CAM in the EU through an independent research strategy. I mean, these are highly idealized goals. But I mean, they're good goals, but I mean, I think their achievability is going to be really quite difficult. But nonetheless, these are what they consider would be useful and necessary. And obviously, I think this has been inspired by what they did in America with the NCAM thing, and they're thinking along similar lines that the American government set up a specific office and specific funding for CAM research, and this is what's inspired this proposition here. So, the final comment. Such a strategy is required if complementary and traditional medicine is to shift from its marginal status in most countries to having a significant role in national health care. Political intent as well as scientific intent are needed to support such an agenda. Ultimately, nothing will be considered complementary, alternative, orthodox, or conventional. Rather, all possible contributions to health will be evaluated for their promise and harnessed for the good of the public's health. I think that statement was, there's a link there to Bodecker, who did a big report back in 2002. Whether that's taken straight out of the report, I don't know, but that was their final concluding statement. So what's happened is that they've published a series of reports. Some of these reports only went in a couple of months ago. Although the project finished in December, they had to write a lot of the reports and finish them up. And the report on the provider's perspective, for example, only went into the commission about 2 months ago, because there was so much ongoing debate with what had been written in it. And but now all the reports have gone into the commission. I think they're sorting out final financial bits and pieces to do with budgets and costs, etc. And they've produced a series of documents, all of which you can download and find and download on the CAMbrella website itself, www.cambrella.eu. So their reports should all be up there, and you can download and read them at your leisure. And they've also, in Forskning Komplementärmedicin, there was a whole issue dedicated to the project sometime last year, I believe. So, you know, they've had this project, and it's gone on for the last 3 years. I think the guys and girls, women and men who did the project are all kind of really worn out. There was a vast amount of work involved. And, you know, there were 16 institutions in 12 countries and a whole lot of people. And, I mean, there was some money to reward them for their services. But, I mean, 1.5 million over 3 years between 16 institutions is not a lot. And I think they've all taken a deep breath and sat back and kind of like, wow, thank God that's over. But where do we go from here? That's the question. And they've put forward their recommendations for the roadmap. And the thing now is to pick up and go seek money, well, I would suggest first from the European Union. And I just thought as I've got a little bit of time, I just thought I'd bring to your attention the next, DG Research works in what they call framework programs. And they run for 7 years, and then they set up a new framework program. And this one was done under FP7. And that comes to at the end of this year. And the new framework programs kicks off in a couple of months' time and runs to 2020. And instead of calling it FP8, they're calling it Horizon 2020. And this is the new research program. And every time they create a new framework program, they change the way they structure and word it, the programs and the calls in it, as they learn and as they go on. And the next phase, this new program, is been divided up into particular ways, and there's a big part of it. I mean, the big part of it is there's a big part of it called societal challenges, and this is a number of challenges which is facing the EU, and this section of the EU research budget for the next 7 years has 35 billion euros dedicated to it. And within societal challenges, there's a section devoted to health, demographic change and well-being. And the specific objective is to improve the lifelong health and well-being of all. And if you remember the presentation I gave you yesterday, where I gave you a whole list of things that the EU is currently concerned with, things like antimicrobial resistance, healthy aging, chronic diseases, etc., etc. And they've realized that these are really major problems. First of all, they're major problems from a health point of view, but they're also a major problem from an economic point of view. And the other thing is what they talk about healthy workforce. We must have a healthy workforce so that Europe can be successful financially and lead the world, etc., etc. And so we must have a healthy workforce. So it's like, do we need people to be healthy so they're healthy and happy, or do we need people to be healthy and happy so we can feed the monster? But that's another question. Anyway, this particular subject, health, demographic and well-being, has 9 billion euros to be spent over the next 7 years. Now, we really need to get into this money. It's really, and the agenda, I think I intimated yesterday, the agenda at EU level is changing. It is shifting. Their ears are pricking up. There is an awareness of complementary alternative medicine developing amongst certain areas in DG Sanko, etc. And the way these things are now being worded, there are openings for us. There are hooks in the text of these documents that researchers can put projects on. There's also another section called industrial leadership. Again, they want the EU to be a leader industrially and in science. And this has a budget over the next 7 years of 20 billion euros. And there's a subsection to it, leadership in enabling industrial technologies, which has a budget of 15 billion euros. And in there's a section on nanotechnologies. Nanotechnologies are a spectrum of evolving technologies with proving potential, having a revolutionary impact on example materials, ICT, life sciences, and healthcare, and consumer goods. Now, I mean, what they think about nanotechnologies is like little robots roaming around your body. But nonetheless, what I was saying to Lionel, I think at lunchtime, is that these are hooks. And you've heard talk about nanoparticles, nanobubbles here this weekend. And we need to really get in on this money. And so there is potential, I think, even for researching some fundamental research in our area and also researching the nature of our medicines. So what I'd like to end up saying is that with EuroCam, which is the consortium, the stakeholder group, which we're a member of, which I talked about yesterday, we're going to have a meeting with DG Research together with some of the people from CAMbrella very soon to follow up on the CAMbrella report. But what I would like to suggest is that the community of researchers, CAM researchers across Europe, and there aren't that many of them, but really they need to have a meeting sooner rather than later and to really brainstorm the words in Horizon 2020. I think there are hooks and openings in the bit on health and well-being, and even within the industrial leadership things to do with, there's a whole section on what they call innovative medicines. Now, innovative medicines to them is biotechnology stuff. It's all based on genetics and chromosomes and all that sort of thing. But homeopathic medicines can easily be categorized as innovative medicines, particularly in the sense that they're not widely used across the healthcare systems at the moment. So I really would like to end this by making that recommendation that our small community of researchers gets together sooner rather than later and brainstorms the contents of Horizon 2020 to see what multinational, multi-center projects, and that's the problem, can be set up to get some of this money. Because it's the only real public money we can have access to, and there's oodles of it. So thank you very much. Go to the website, get the documents, you can read about the project.
Thank you very much, Stephen. Questions for Stephen? There's got to be plenty of questions for this.
Not necessarily. People are just tired.
Yes. Any questions? Okay, Stephen, thank you very much.
Okay.
Well,
Hang on. I'd like to say something.
Okay.
First of all, I'd like to say thank you to Birgitta. On behalf of all the speakers, thank you. I mean, this has been a wonderful conference, and I'd particularly like to thank your technician, whose name I've forgotten,
Annika.
who's been so quietly efficient here. There. So please give her a big hand. In case no one else does it, can I also ask you to thank Birgitta for all her wonderful work and all her team. I know you've got a team, I don't know who they are, but thank you for organising the whole thing on behalf of all the speakers.